Understanding metastatic uveal melanoma. Uveal melanoma, also referred to as ocular melanoma, is the most common eye cancer in adults, affecting about 2,000 people each year in the United States. It starts in the uvea, a layer of the eye. When the cancer spreads beyond the eye, it is called metastatic uveal melanoma. About half of patients will develop metastasis, most often to the liver, although other areas can also be affected. Several factors influence the chances that uveal melanoma will spread, including the tumor size and location within the eye. If a biopsy of your tumor can be performed before treatment, genetic testing of a tumor sample can also help predict risk. Tumors with normal genetic or chromosomal features generally have a lower risk of spreading, while those with certain genetic or chromosomal changes are associated with a higher risk of metastasis. Specific gene mutations in the tumor or other tumor markers can also influence how aggressive the disease may be. Surveillance after initial treatment is critical. Regular scans and checkups can help detect metastasis early, when treatment may be more effective. The frequency of scans depends on your risk and the schedule your doctor thinks is most appropriate. If uveal melanoma spreads, treatment options depend on where the cancer has spread and your HLA type, a genetic immune marker. Your doctor can determine your HLA type through a blood test. Knowing your HLA type is critical because some treatments, like tebentafusp, are only effective in patients with the HLA-A 0201 marker. Systemic therapies or whole-body treatment may be recommended. Because uveal melanoma commonly spreads to the liver, treatments focused on the liver or liver-directed therapy may also be an option. Tebentafusp, known as Kimmtrak, approved in 2022, is the first drug developed specifically for metastatic uveal melanoma. It works by helping your immune system target and kill cancer cells, but it only works if you have the HLA-A 0201 marker. In clinical trials, tebentafusp significantly improved survival compared to other treatments. The first 3 doses are usually given in the hospital with monitoring for side effects. Afterward, treatments are given in the clinic. Percutaneous hepatic perfusion, or HEPZATO, was FDA approved in 2023. In this approach, doctors deliver chemotherapy, specifically melphalan, directly into the liver. Then filter the blood, before returning it to the body using catheters placed in the arteries and veins of the neck and groin. This treatment is performed in a hospital setting under general anesthesia and may require overnight stay in the hospital. This method has shown encouraging results for patients whose tumors are mostly located in the liver. Outside of these 2 treatments that are FDA approved specifically for metastatic uveal melanoma, there are a number of other possible treatments, including other forms of liver-directed therapy, immunotherapies, and clinical trials that are commonly used. Ask your doctor what clinical trials or new treatments might be right for you. Clinical trials offer access to promising new drugs before they are widely available. Participating in a clinical trial may help you and others by advancing future treatments. Some trials require that patients have received no prior treatments, so it's important to discuss this option early. There are also active trials designed for patients who have completed initial eye treatment but do not yet have metastasis. These studies aim to reduce the risk of the cancer spreading in the first place. Ask your doctor about clinical trials for both non-metastatic and metastatic uveal melanoma, or use the Melanoma Research Foundation's Clinical Trial Finder to explore options. If you have metastatic uveal melanoma, it's important to learn about your disease and the treatment options available. You should also know your HLA type, tumor genetics, and consider getting a second opinion at an expert center. Having a plan early ensures that you don't miss opportunities for treatments or clinical trials. Metastatic uveal melanoma is a serious diagnosis, but new treatments and clinical trials are expanding options. It's important to stay connected with your care team and keep informed about research developments. Patient groups such as the Cure-OM initiative, part of the Melanoma Research Foundation, offer valuable support through patient forums, support groups, the Eye on Ocular Melanoma newsletter, and the annual Ocular Melanoma Patient and Caregiver Symposium called Eyes on a Cure. With expert care and newer therapies, many patients are now living longer and with a better quality of life.